All right, we need to talk about a complication of diabetes that is way more common and, frankly, way more dangerous than most of us think. I'm talking about diabetic foot ulcers. And we're going to dive in because what looks like just a small sore on the foot can be hiding a life-threatening secret. So, I want to start with this number. Just look at it for a second. 50 to 70%. It's a huge number. And you've got to be wondering, what on earth could this be referring to? That number, that's the 5-year mortality rate after someone gets their first diabetic foot ulcer. To put that into perspective, that is a higher death rate than many, many forms of cancer, including breast and prostate cancer. So no, this isn't just about a wound, it's about survival. Which of course leads us to the big question, right? How can something that starts as a simple blister, maybe a tiny cut from a pebble in your shoe, lead to something so incredibly deadly? Well, the answer is, it's a perfect storm of things going wrong, all happening below the ankle. You see, a diabetic foot ulcer, or a DFU, it doesn't just happen because of one thing. It's more like a chain reaction, a cascade of failures where the body's own systems start to break down in a really specific and really dangerous way. And this diagram here, it lays out the whole problem perfectly. We're going to walk through this whole pathway. We'll start with the nerve damage, then we'll look at the poor circulation, and finally, we'll zoom all the way in to see why the body's own cells just can't heal the wound. Okay, first up, peripheral neuropathy. Now, think of the nerves in your feet like a high-tech security system. They're supposed to send an immediate alert when there's danger. You step on something sharp, your shoe is rubbing a raw spot. But in diabetes, high blood sugar can just fry these nerves, basically shutting that whole security system down. You literally lose the gift of pain. And this nerve damage is a triple threat. The sensory loss means you could walk around all day with a nail in your shoe and have no idea. The motor damage causes the muscles in your foot to weaken and shrink, which can create deformities like hammer toes, creating all new pressure points. And finally, the autonomic damage messes with your sweat glands, so your skin gets super dry and brittle, cracking open and just rolling out the welcome mat for bacteria. So picture this. You've got an injury you can't feel on a part of your foot that's fragile and under a lot of pressure. Now, the body should send in the repair crew, right? But that's where problem number 2 kicks in, peripheral artery disease, or PAD. Diabetes causes the blood vessels to narrow, creating this massive traffic jam that prevents oxygen, nutrients, and all the healing cells from ever reaching the construction site. And PAD in someone with diabetes it's just a whole different, more aggressive beast. You can see it here. It doesn't just hit the big arteries, it goes for the smaller ones below the knee. It doesn't create one little blockage, it creates long, diffuse sections of blocked-off highway. And it hardens the artery walls with calcium, making them rigid. All of this makes it incredibly difficult for a surgeon to go in and fix the plumbing. Okay, so we have an injury we can't feel, and the supply lines are cut off. But the story actually gets even crazier. We have to zoom in way down to the microscopic level, because even if a few resources manage to get through that traffic jam, the repair crew itself is, well, it's completely broken. Healing a wound is normally this beautifully choreographed dance between all these different cells. You've got your first responders, your cleanup crew, the rebuilders who lay down new tissue, the whole shebang. But in the high-sugar, high-inflammation world of a diabetic wound, every single one of these key players just doesn't work right. So take the macrophages. They're the cleanup crew. Normally, they come in, eat up all the debris and bacteria, and then they flip a switch and signal the rebuilders to start their work. But in a diabetic wound, they get stuck. They just stay in this angry, inflammatory state, basically screaming, "Demolish! Demolish!" over and over, so the wound never ever gets the signal to start rebuilding. And then you've got the neutrophils, the first responders. You'd think they'd help, but they actually make things worse. They start doing this thing called netosis, where they literally spit out their own DNA in these sticky webs to trap germs. But in these wounds, they do it so much that it just causes more inflammation and more tissue damage. It's incredible. The very cells that are supposed to fix the problem are actively making it a chronic, non-healing disaster. Now, this whole biological catastrophe, it doesn't happen in a bubble. It gets magnified by things happening in the world around us. Because the painful truth is, the burden of diabetic foot ulcers is not shared equally. Not at all. Yeah, your biology is a factor, but the research is crystal clear on this. Where you live, how much money you make, and your race play a huge role in whether you get one of these ulcers, and even more importantly, whether you end up losing your leg. And this chart just spells it out. If you're in a low-income or rural community, You're just less likely to have access to a podiatrist or the kind of preventative care that can stop this from happening. And study after study shows that these factors, along with persistent racial disparities in our healthcare system, put you at a much, much higher risk for amputation. And what's really scary is that the problem seems to be getting worse, not better. After years of progress, some places have seen amputation rates shoot up by as much as 50%. And this isn't affecting everyone equally. It's hitting younger adults and minority populations the hardest. It's a huge step backward. So after hearing all of that, it would be really easy to just feel completely hopeless. But here's the most important thing I want you to take away. So much of this is preventable. The entire game changes when we shift our focus from treating a disaster to preventing it from ever happening in the first place. And the single most powerful weapon we have is the annual comprehensive foot exam. This is not just a quick glance. A trained provider is looking for pre-ulcerative signs. They're doing a sensory test with a special little filament to check if your security system is still working. And they're checking your circulation to catch PAD early. Of course, that professional checkup has to go hand in hand with daily self-care. And the real power here is just consistency. Taking 30 seconds every single day to look at your feet can mean you catch a problem when it's just a little red spot, not a full-blown ulcer. And simple things like never going barefoot and making sure your shoes actually fit, these are the things that prevent that initial injury from ever occurring. And look, let's not forget the absolute foundation of all of this, blood sugar control. Amazing research shows that if you get your glucose under control early in your diagnosis, your body creates something called a metabolic memory. It's like your cells remember that period of health, and it gives you a protective shield against complications like these for years, even if your control isn't perfect later on. That is a massive incentive to get on top of it early. I want to leave you with this quote from one of the studies, comparing a foot ulcer to cancer. I know it sounds extreme, but when you think about it, how it keeps coming back, the crushing financial cost, and its horrifying impact on mortality, you realize the comparison is disturbingly accurate. And that brings it all back to you. We've seen how biology and society can create this devastating path from a small cut to a major crisis. But the power to get off that path, to stop that chain reaction, often starts with one simple choice, one simple action. So the question is, what's the first step you can take today?